At the outset, I would like to thank the organizers and the chair of the speak, and also the co-chair, and as well as my co-speakers. Like the chair mentioned, health tech startup. We call it ourselves a startup, although we have been now in the 9th year of our existence. Essentially, MediBuddy is a platform which aggregates all health services, starting from your preventive to primary healthcare services and all the way to secondary healthcare services throughout the country. Today, my objective is to more talk about technology and how operational automation has kind of helped to build the occupational work culture. So that's the agenda. I will just quickly run through. I realize there is only 7-8 minutes more, so I will run through quickly this presentation. Is first to kind of bring us into the context, saying what's the real competitive edge for companies today, right? Let's look at that, and then we'll talk something about employee engagement. Our experiences are more from an organized sector and employees' expectations and how we are addressing that, along with the organizations which provide such benefits. And what are the emerging trends in employee engagement, and what employees want from the organization, and how we are addressing that. So I think it goes without saying, in the third industrial revolution, right, what was more a strategic advantage for a company was land license. And with more and more countries becoming or attempting to become a place for easy to do business with, this has changed significantly. At least in the fourth industrial revolution, this has now become anything to do with technology, although I'll call it as laptop, internet. And more importantly, it's the talent itself, right? More and more employees are the strategic advantage of a company. It's not anymore the license or the land or the factories which you used to have, because most countries have opened up and reformed significantly. Now, now that we have kind of established the employees are the strategic advantage for a company, what are companies doing to kind of retain them? How do you improve engagement with them, and how do you retain them? So this is an experience which we have 9-10 years, like I mentioned. In terms of top employee engagement management is first managing their overall motivation. And when I say motivation, it's both not at the workplace motivation, it's also their health and physical and mental health, right? More importantly, this has now become, earlier it was more about just the employee. Post-COVID, this has become more family as a unit, and I will talk about it more as how the healthcare requirements, at least from an employee perspective, has changed pre-COVID and post-COVID. Before that, let's talk about the emerging trends in the fourth industrial revolution world, right? At least in the employee engagement. More and more it is becoming clear that employees require a single point, in this case, a single platform for delivery of this. Often it is very difficult to even first look for what kind of services providers are there in the market, what services at what point of time, and how you can access at what prices, right? This discovery process itself is a big challenge for employees, and that being addressed largely through a single platform. The next one is data security. I think even governments like ourselves in India have started talking about data privacy, and health is in the sensitive data, right? One of the reasons, and it is at least in our experience, that the reason why more and more people actually use platforms like ourselves on mental health is largely because their ability to kind of secure that data and keep it for themselves without access for anyone else, right? So that has become, and of course the government also requires us as an organization which handles health data to ensure that safety and security of the data. The last but not least, e-commerce-like experience has become an important aspect in every facet of your life. Today morning when I landed in the Delhi airport, I realized my internet service was not available, right? And I started blasting the service provider. I called them, and because that's so important, because I couldn't book a cab, right? So the whole JAM strategy, for those who are not familiar, at least in this country, it is Jan Dhan, Aadhaar, and mobile. Even the government has been aggressively progressing with this strategy, be it payments, be it taxes, GST, everything, UPIs. I mean, United Payment Gateways in India is probably a lesson for the world. And taking lesson and leaf from that, the government has also now tried or is moving towards the ABA, which is the digital integration and providing of healthcare and healthcare providers, right? So we are kind of working in that direction. That's more from top down, from the government perspective. But from an employee expectation, the expectation is, hey, I need my service here and now. I should be able to access it quickly. I should be able to find it quickly. I should know what's the affordable price. I should know when my paramedic will come to my home and so on. So that kind of experience expectation has also changed. So in addressing all of this, these are the services which we see a lot of traction on our platform. This is pre-COVID, but has not changed significantly in the post-COVID world. But most important is the online doctor consultation. When I talk about online doctor consultation today, in remote consultations, but be it video or teleconsultations, we are able to handle almost 2/3 of all patients who come to our platform for an health query, right? And this can range in any specialty, starting from your as complex as a dermatological problem to a pediatric problem and so on. In fact, like I mentioned earlier, mental health is the third or fourth most consulted department in our platform. Organizations have also now started looking at providing annual health checks to kind of assess the health risk over a period of time, to use the longitudinal data and see what's the status of their organization as a healthy workplace. This is important in a country like India, largely because we are still a very long way in standardizing the health data and also keeping a longitudinal data of each and every individual, right? Therefore, it becomes important for us to at least periodically check this health and know how this health is progressing, or at least the health risk is progressing within an organization. There are also needs for programs which are related to maternity and child, various condition management like diabetes, hypertension, and even things like hair loss and skin care and so on. While we may think that this may not be part of occupational health, but think from an employee perspective, this is becoming more and more important, right? The EAP is actually mental health, which I mentioned earlier. That aside, it's also for them. When in the beginning of the conversation, I mentioned almost 2/3 of all consultations get managed in our platform. What happens to the rest 2/3, right? 1/3. The rest 1/3, actually, we kind of follow an O2O model, which means online to offline. So if my specialist on the platform cannot handle this particular case, they will be referred to a network doctor on our platform. The appointments will be booked and they can seamlessly access those services. Now, once the consultation has happened, what happens next? So typically in India, most consultations end up in a prescription, which 2/3 of the prescriptions either have a lab or a pharmacy, or sometimes both, right? Now, how do you fulfill that service immediately? That's where we actually provide an immediate auto cart kind of once a prescription is generated, it actually creates its own cart for you to place order for the labs, for someone to come at your home and take your blood sample or any body fluid sample as required by the doctor, or even the delivery of medicine. Today, with the kind of network we have in India, we are able to deliver medicines to almost 95% of all PIN codes in India. So I think this is what I was talking about, e-com-like experience, which employees now demand for managing their health. And this is only enhanced post-COVID. I think quite a lot of it was covered earlier also in terms of second opinion, home health care, and vaccinations, right? The whole COVID vaccination has brought in another level of awareness of all other adult vaccination. Adult vaccination as a concept in India never existed, right? At least that is coming back now and has changed significantly. So this is something I talked at the beginning of the conversation, saying that what kind of data security we are providing. I will not go into the details, but like I mentioned earlier, it's important to make sure that the platform is not vulnerable to any external attacks, so that any individual's data is not kind of leaked, for our unnecessary users, right? So that's absolutely important for us, and being a health tech company, we kind of thrive on this. The next important is also, which I talked about earlier, and in the afternoon we were having this conversation. While we all talk about mental health at workplace, it's often difficult for an employee to, one, access, two, to be assured that any outcomes of this mental health assessment is not being shared within the organization, because it's still a stigma in this country, right? So those kind of data privacy, data access restrictions are significantly enhanced through a platform like ourselves. And of course, if you know digital assets, right, it starts from your web browsers to your mobile web browsers to applications on your platform, on your mobile. So one should be able to kind of seamlessly move through all these digital assets. With our technological capabilities, we can let that happen, starting from your organization's website to your mobile website to your applications, right? There is a seamless movement you can have. Now, this is something, while it's a busy slide, I will talk what it's trying to tell here, right? Most of us use e-commerce and food delivery systems in our day-to-day life. One of the things we want to know, and how quickly that person is actually going to deliver. Second thing is, where is on his way, right? And can I talk to that person? And those kind of visibility we actually bought in healthcare. So you can literally see your phlebotomist who's coming to your home to collect sample, where he is currently, and if you have to pass on directions and so on, you can do that. So what we do is not just actually wait for someone to be delayed. For example, let me say I'm fasting in the morning and I want the phlebo to come and collect my blood samples at 8 o'clock in the morning, and for some reason, and it's not very unusual in India, right? Traffic jams and so on, if the phlebo cannot make it, because we have predictive data analysis going on a proactive basis, we actually can predict what number of orders today will get delayed, and we proactively reach out to the customer and tell them, hey, here is yours supposed to come at 8 o'clock, but given this scenario, he will be at 8:15 or so on, right? And that kind of experience is what today employees and their families also kind of started demanding now. Something which I want to talk in detail, but I will just run quickly through it. I think earlier, it was more occupational health was at least seen as what we do at workplace, but with the hybrid workplace coming into fore, right? It has also become important as what kind of health benefits and access I have, what kind of have when I'm traveling for work, and also what happens when I'm at home working for the organization. So I think it has kind of only expanded as saying occupational health is not just restricted to the official premises where you are, but if you're working from home or if you're traveling for work as well. And this is where platform like ourselves, for example, whether like today morning I was in Bangalore, today now I'm in Delhi, I can access my healthcare services irrespective of where I am, right? That's a survey which we conducted, and that's the expectations from your employees. Predominantly what they look at is, can I have an annual health check program which I can kind of keep track of my health records? And the second one is, of course, remote consultations. And I will leave with one or two thoughts here on some of the data points on online doctor consultations, right? Prior to COVID, we were a platform where people used to come for consultation for departments which require a lot of privacy, which could be your psychology and sexology and so on. But post-COVID, what has happened is women have kind of adopted this platform largely. Today, the third largest consultation in our online platform is gynecology, followed by pediatrics. 60% of all our consultations happen post 6 p.m. before 6 a.m., which means the platform has improved the access to a doctor out of doctor office hours. So that's the problem we actually set out to solve in the beginning, when we started this organization. And it's heartening to see that, typically women do not adopt this, at least that's my experience when I was in the financial world, right? They do not adopt technological platforms easily when managing their finances, but when it comes to the health of themselves and their children, they're the first ones to adopt that. Because we manage health and wellness needs of more than 3 million employees and their families, we kind of now have understood clearly there is a demography-based and gender-based needs across various age groups. I will not talk about this in detail, but that's the kind of data which we can understand what segment of customers or employees require what kind of health services at different point of their ages. Right? I'm not going to talk about this. Yeah, let me conclude that, at the end of the day, to the expectations of employees when you define occupational health has slightly changed, or if you want to kind of really look into it deeply, it has changed significantly since when we started. In fact, it was very difficult to build awareness even for the benefits which was offered by their employers, right? There were less than 2% or 3% of employees who would use any service offered by the employers. Today, this has significantly changed. More than 50-60% of them definitely use within that period. I think building awareness has one aspect of it. The other aspect of it is building the confidence, saying, hey, your data is safe, accessibility is easier, helps in building, and goes in a long way in building the occupational culture, health culture. Thank you, everyone.